There are 5 things that I would avoid as an allergist. Number 1 is food sensitivity testing. This is commonly sold direct to consumer as a blood test to measure an antibody that's produced by your immune system called IgG, which is actually a tolerance antibody. You want these antibodies to be made so that your immune system does not have allergic reactions to that food. So when you get these tests, it'll commonly say that you are positive to things that you're normally exposed to, but that does not mean that you're actually sensitive to it. It's not scientifically validated for that purpose. Number 2 is using a nasal decongestant spray such as oxymetazoline for more than 3 to 5 days in a row, because it could cause a rebound nasal congestion known as rhinitis medicamentosa. You end up having to use more of the medication to get a similar benefit, and when you try to go off of it, your nasal congestion can actually get much worse. Number 3 is using Visine eye drops to treat red eyes. This medication works by shrinking blood vessels to reduce that redness, but over time your eyes get used to that and you end up having a rebound redness that can be worse than before. Number 4 is diphenhydramine, also known as Benadryl. This is a first-generation antihistamine that can easily get into the brain and cause people to be tired and have poor concentration. About 10 to 15% of people have the opposite effect, where they may become more excitable, aggressive, and or moody. And there can be anticholinergic side effects associated with this medication, especially at higher doses or in the elderly, where you could have a dry mouth, blurry vision, urinary retention, constipation, and at high doses you could potentially overdose on it and it can be life-threatening. We now have newer, safer, second-generation antihistamines in Zyrtec, Claritin, Xyzal, and Allegra that are less likely to get into the brain and do not have those anticholinergic side effects. They also tend to last longer than something like Benadryl, so you should talk with your doctor to consider some safer alternatives. Lastly, I do not recommend oral phenylephrine to treat a stuffy nose. This medication is commonly sold over the counter, often in combination with other medications as a cough and cold remedy. However, an advisory committee for the FDA recently ruled that this medication is not better than a placebo in treating a stuffy nose. The whole body of the FDA has not ruled on whether they're going to remove this from the market, but this medication is pretty much useless for people.